Hi, my name is Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Tuesday, August 25th, and this is our COVID briefing. We've had 410 cumulative positive cases in Missoula County to date. That's up 17 cases since my last update 5 days ago. We've gotten in 3 new cases since yesterday. We've had 363 recoveries and 3 deaths. 3 Missoula County residents and 2 non-county residents are currently hospitalized for COVID-19 in Missoula County. We have 44 active COVID-19 cases with over 220 close contacts at this time. Those active cases and their known close contacts will remain in isolation and quarantine and will be supported as needed. The state of Montana is reporting 6,624 cumulative COVID cases, which is up 136 new cases since yesterday. There are now 1,636 active cases with 119 active hospitalizations across the state, and there have now been 97 deaths related to COVID-19 statewide. Today I want to talk a little bit about mental health effects of this prolonged COVID-19 pandemic. First, I just want to acknowledge that we're all really tired of this pandemic. Many of us have experienced a variety of emotions, from anger to fear to sadness, as COVID-19 just keeps continuing. Some have also experienced increased stress and anxiety, and as you may wonder what will happen with you or your loved one if one of you gets sick with COVID-19, others are experiencing depression and social isolation as they're trying to protect themselves, and they lose that in-person connections that we all really need. Others may be wondering what will happen to their business if they have staff who get sick. Many are facing financial challenges that can lead to increased stress. I get it. I'm a mom. I have family members who would be at increased risk of bad outcomes if they contract COVID-19. My husband and I are also small business owners here in Missoula, so I understand the challenges that this has presented, and I'd just like to share a little bit about how to cope with the increased stress and anxiety brought about by the pandemic. Some of the stress, anxiety, or depression can manifest in different ways for different people. You may see changes in your sleeping or eating patterns. You may have difficulty sleeping or concentrating. You could have worsening chronic health problems or worsening mental health conditions. These are just a few of the ways that chronic stress and anxiety can lead to physical symptoms. It's really important to take care of your mental health. If you're experiencing thoughts of suicide, please call 1-800-273-TALK. or send a text message to 741-741. If you're not in crisis but you need mental health support, please call the Montana Warm Line at 877-688-3377. There are also many community resources that may be available to help support you during this really stressful time, and you can find those resources at covid19.missoula.co. There's a whole array of resources there for you. In addition to accessing local resources, some of the things that you can do to help reduce stress and anxiety include getting regular exercise. Try to eat healthy, well-balanced meals, and get plenty of sleep. Try to make connections with family and friends. You may not be able to get near them, but you could try connecting on other platforms such as video chatting, or you could have a socially distanced backyard visit. You should try to make time to unwind and participate in activities that you enjoy. Connect with your community or faith-based organizations. That human connection is so important during times of increased stress. It's important to stay informed, but also to know when you need to take a break from the news, as hearing about the pandemic repeatedly can just cause an increase in stress. Be sure to have a plan for what you will do if you or someone that you care for develops symptoms. Call your healthcare provider if you're experiencing worsening chronic conditions or worsening mental health conditions. I know that we're all beginning to feel quarantine fatigue, and we just want this pandemic to be over. In the meantime, though, it's important to take care of yourself and your mental health as well as your physical health, and also to continue practicing those preventative measures like social distancing, hand washing, and wearing the cloth face covering. So we will get through this together. It just is going to take a little bit more time. So try to hang in there and take good care of yourself. That's it for my daily briefing for today. As always, you can subscribe to us on YouTube under my name, Cindy Farr. That's CINDYFARR. You can give us a call at 258-INFO if you have questions about resources that might be available to you, or if you'd like to schedule a test for COVID-19, or you just have general questions about COVID-19. You can check out our website at missoula.co/cvirus, and you can follow us on Facebook at the Missoula City County Health Department's Facebook page. So until tomorrow, everybody, stay healthy.